Beverly Hallberg, conservative strategist and president of District Media Group. Thank you both for being here. First off, just your reaction, Brad, to what we just heard from that very emotional plea from Jimmy Kimmel.
It was a very emotional plea, but I think he speaks for tens of millions of Americans who find themselves with health conditions. They find it difficult to access insurance, perhaps not even possible to get insurance. And that, I think, is the fundamental debate. Rather than all the intricacies of health insurance, it's about asking this philosophical question. Do people have the right to have health insurance or not? And should it be based upon your income level or not? And I think that issue is resonating across the country, and that's why Republicans are finding it so hard to repeal Obamacare.
But Beverly, you don't necessarily agree with the point he made about pre-existing conditions, is that right?
Yeah, and I want to start by saying when I watched that, I teared up the first time I saw it. I am the aunt I'm an aunt of a sweet little boy who had open heart surgery shortly after he was born because of 4 heart defects. So when I heard the story, I teared up as I was listening to it. So I think it's great that he was that transparent, that open. I would agree with him that we as Americans, whether Republican or Democrat, can come together on the fact that any child going through this should get the care that he or she needs. What I disagree about is that the answer to these problems is Obamacare. So when it comes to pre-existing conditions, Republicans are talking about having health care that does have pre-existing conditions as an element of that. But the issue is, one of the reasons why health care is so unaffordable to begin with is because of so many of these policies of Obamacare. As a small business owner myself, my premiums have tripled since Obamacare has passed. There are a lot of Americans across this country struggling to afford it. We need to get to the heart of the issue, which is cost and also quality of care.
Let me ask you this, Brad, because we heard the president say that this GOP bill will guarantee coverage for those with pre-existing conditions, but the reality is that states can opt out. I mean, this is sort of the big sticking point between conservative and moderate conservatives. So what's going on here in your view?
I think they're trying to water down the pre-existing condition. The Freedom Caucus and perhaps the people on the far right of the House GOP conference don't believe in covering pre-existing conditions. The waiver will no doubt be exercised by 30 or more states across the country, so effectively ending the requirement that pre-existing conditions be ignored in the issuance of insurance. That's bad for the country, and that is why I think you're finding it so difficult for people to come around to this.
And Beverly, our reporting is, our latest count is that Republicans are 1 no vote away from this crashing and burning again. What do you think is going to happen? Do you think they're going to get it?
Well, I would hope that the Republicans would make sure that they have all the votes before they move forward with this. It was a PR disaster the first time. I think it would be a PR disaster this time. But what I will say is one of the reasons why they're working so hard, because let's not forget President Trump said he was going to move on to tax reform. The reason why you see so many Republicans in the House really trying to push this forward is because this is what Americans want. This is one of the reasons why many of them got reelected, is that people are struggling under the weight of rising health care costs, and they're saying you have to do something about it. So I think you're going to see Republicans continue to battle this out. I would be surprised if they put anything on the House floor for a vote that they weren't sure they had all the votes on. It would be disastrous if that happened.
Paul Ryan won't bring it to the floor unless he knows he has the votes. But it's still politically dynamite because the Senate's unlikely to accept these kind of House changes. And therefore, people are walking the plank, in all likelihood, for a bill that may never come to be realized.
All right, we'll have to wait and see what happens on that front. Beverly, Brad, thank you both.
Thank
we
you.
appreciate it.